Thank you so much for this very interesting question. So let's go back to the Indian reality. Indeed, many of the news are gloomy for the reason that India is an emerging country in many ways. But we are seeing progress, a lot of more professionals being treated and a lot more awareness regarding risk factors and the importance of early detection. Let's start with women. The main cancer types in women in India today, as I mentioned to you, breast cancer. 27% of cancers among women are breast cancer. This is massive. It's really huge. What women can do? Women can avoid using hormones when they are turning menopausal. You know, when a woman turns menopause, there are lots of symptoms. And usually women were used to take hormones to prevent the symptoms or to decrease the symptoms. Many times this is advisable medically, but the limitation of the duration of using the medicines is very important, and use a low dose. Also, women can avoid becoming overweight and obese after menopause. Usually, when we turn menopausal, we tend to put on weight for hormonal reasons. That's an important risk factor for breast cancer. But even if the women do everything right, many women, half of all breast cancer cases occur in women that have zero risk factors for breast cancer. So if awareness, any changes in your breast, and that you can yourself feel or have a healthcare professional examining your breasts regularly, that's already something is better than nothing. Actually, most of the breast cancer cases are detected by the women themselves because they feel that there is something strange going on. Changes in the skin, a lump, or something different in the breast, a discharge of the nipple. Some women have access to mammography screening. Mammography screening is a good way to detect breast cancer early. Not all women have access to it, but if women have access to it, in particularly between ages 50 and 65, it's advisable that they do eye screening every second year. However, even so, many women that do palpation, that do mammography screening, and that have no risk factors, they will still develop breast cancer. Maybe they have the genetic susceptibility. Breast cancer is highly treatable, in particularly if detected early. So women that have a breast cancer detected in early stages, almost all of them survive 5, 10, 15 years, and they happily die at old age by something else, like cardiovascular disease. So breast cancer is common. Most of the women here will face it in themselves or in their family members. We should not be afraid of it, but we need to act fast. And women need to be aware and not to be ashamed when there is something different in their breast, to talk to a healthcare professional as soon as possible to get it diagnosed and treated. Very good news, the treatment now is so efficacious that if women search healthcare, even if they have never been screened before, their survival is almost the same as if they were screened before, but they need to go early.
So thank you, Sangeeta, for a very pertinent question.
I'll make a comment as a clinician. As a clinician, 33 years in cancer, I'm optimistic that we can prevent half our cancers. We can have early detection and have an 80 to 90% cure rate for the majority of our cancers. I'm only going to quote the #1 cancer in our country which I treat, oral cancer. It's because of tobacco. Even if we find it difficult to ban tobacco, we can tell people not to consume, and any dentist, any ENT, and I think that message should be taken. We always talk about the fancy new treatments, immunology, various other things. And the other message is that even the plain areca nut, which is the supari, is a grade 1 carcinogen, class 1. So we have to take these kind of powerful messages to the people, and I think, like everybody said, we all have to do it.
If I could just add for 20 seconds, I'm going to echo what the two doctors said, both as a clinician and as an administrator. I worked with lung cancer throughout most of my career. And in the early part of my career, it was not a curable disease by and large. And that changed. That changed when we figured out that we could use low-dose CTs to detect early cancer in the right patients. And the message here is that the biggest impact in healthcare outcomes have not come from medicines, as Dr. Nichols said, right? There have been some like streptomycin for tuberculosis. Most of it has come from public health measures, polio vaccine, sanitation, childhood vaccination, right? Better nutrition. And this is the era for us to take that paradigm to cancer, right? Prevention, healthy habits, and early detection when possible. So I think this is where, and the current generation is very savvy and very health conscious. I think it is our job to get this message out.